We also have Dr. Sudhir. We also have Dr. Bindumenon, Professor and HOD Neurology, Apollo Specialty Hospitals, Nellore. Dr. Menon is one of the leading neurologists in Nellore. Prior to Apollo, he was associated with Narayana Medical College and Super Specialty Hospital as a professor and head of the Department of Neurology. Welcome, Dr. Bindu, to this program. Dr. Bindu, 5,000 cases, such a massive repercussion on life. Still, and I think some cases it is much more graver or serious than heart attack itself, because as Dr. Padma said, that the loss which happened in your brain, it may not be kind of compensated or recreated. Why do we have such a lack of awareness about something so serious in our country, and when it compared to something like heart attack?
Thank you very much, Mr. Narayan, and I think I should appreciate the force which you are taking forward for the awareness about stroke. Now, as we heard from both of us panelists earlier, stroke is posing a major health threat to the country, globally as well, and to the country as well. And I would say it is in three spheres, if one would look at it. One is when we look at it as a mortality, that is a death related to the stroke. Second is a morbidity, that is the sufferings which the patient has. And as rightly pointed out, it's not only the patient who suffers, the whole family suffers if the person has a stroke somebody has a stroke in the family. And then obviously the socioeconomic burden which the stroke has in it. Now, we heard that there are 5,000 stroke cases in a day, and that's a huge number. There is every 40 seconds, you mentioned it in your talk, that there are 40 seconds somebody has a stroke, and every 4 minutes somebody dies of a stroke. And then rightly, why is stroke not having the due importance of care and the emergency? And the word itself, as Dr. Padma said, it's a stroke. You need to hit hard. Why is it not having? There are a multitude of reasons for that. One is that from the ages ago, it has been thought that stroke does not cause death, but heart attack causes death. That is why a person is rushed to the hospital. When a person has a heart attack, he keeps his hand on the chest and he rushed to the hospital. Heart attack, that can cause death. And death is fearsome, death is fearsome. The other things can't probably be dealt with is what is thought. But we're not understanding that apart from the death that has been mentioned, the life-changing, the disability which the patient has is much more than a person can have a death. The stroke and the burden which the person has and the family has, all of us as stroke specialists, it's much more, it's too much that a person and a family can bear. So that is one reason which is not receiving, but we should be telling the public that stroke can cause death. And in fact, that is one very important reason. The second reason is that the stroke is predominantly and essentially painless, except for one headache pain, which is one of the symptoms of stroke. Essentially, it's painless. And we all of us know pain is one symptom that makes the person rush to the emergency. If I have pain or anybody has pain, you seek attention. If you don't have pain, you become a little lethargic, saying that, yeah, I can go tomorrow, I'll see, let me take it. It's, pain pushes the person. Chest pain is there, but unfortunately, when a brain has an attack, it doesn't cause pain. In a few sectors, it causes pain in few cases. Then, as Dr. Padma said, the mnemonic keeps changing. Why is the mnemonic changing? Because the number of symptoms of stroke are multitude, It was fast, then it became be fast, then it became save me. It starts from the eye, the hand, the leg, the vision, the speech, the swallowing. And certain of the symptoms are away from the area of the organ, like chest, heart pain, it is here. But brain, how can a person in a village attribute a grip weakness to a brain attack? So our awareness program should be as robust to tell them that these are the symptoms, these are the mnemonics. Probably suggested ways that you have some mnemonic in the vernacular language like we did it in our Telugu language, so that we reach the public in a better manner. And lastly, people do not understand, over decades, we have made a sea change in the treatment, like heart attack, that there is a sea change. Now we have thrombolytic therapy, we have endovascular therapy, in which almost 30% of people's symptoms can be reversed back, we can cure, and we can get the patient back to. So it's not only dil se socho, dimag se socho, you know. Dimag bhi utna zaruri hai jitna dil zaruri hai. Both are equally important. Both should be treated with the same time, and time is brain. Time is brain saved.
Time is brain, and I think sometimes the brain should take precedence on the heart. So yeah, so the more than dil se socho, dimag se socho is also very, very important. I think more than that. And the one part which you highlighted, Dr. Bindu, is very, very important. That I think the absence of pain is something which, you know, kind of delays the whole reaction of the people towards seeking the medical help. We are doing a major awareness campaign in this month about breast cancer, and one of the case a doctor shared that despite having a very big lump in breast, one of the patient, she reached to a hospital on a very advanced stage, and when she was asked, despite having lump, why didn't she seek help? So the answer was because there was no pain.
Absolutely.
So if you don't have pain, then it become a you start taking it lightly.